We're visiting Virginia Family Dentistry with Dr. Carl Block, a periodontist with the team here. Today we're talking about implant dentistry. This is a really interesting topic of conversation and really interesting to note with Virginia Family Dentistry, you have a team approach to making these results happen. First, let's start with, Doctor, what is implant dentistry?
Implant dentistry is really a two-phased kind of treatment. There is a surgical phase of treatment, and then there is the restorative phase of treatment. The surgical phase, which is what my portion is the actual placement of the implant, and the implant is really just the artificial root. The restorative phase involves actually attaching the crown, or it could be part of a bridge on the implant or even part of a denture, and that's something that your general dentist would do.
It's interesting because you would think of that as that two-part process like you've described, and your team would handle the implant root portion, if you would, and then possibly another part of the team here at Virginia Family Dentistry would handle the restorative part, the top part.
Correct,
Yeah.
correct. And
Yeah.
they're the ones that, give the tooth, the part that you see. The implant is the part in the jawbone, the artificial root, the anchor for the restorative portion that goes on top.
Right. So that's sort of the what is implant dentistry. How do you find yourself as a candidate? Who is a candidate for implant dentistry? If you need an implant, when do you find yourself in this position?
Well, there are a number of parameters that we have to look at. One of the first things that we do is we do a full comprehensive medical history evaluation. So there are certain systemic or medical conditions with which it may preclude you from being an implant candidate. And so we work with your physician or physicians. If you have certain type of systemic diseases like diabetes, or if you have osteoporosis, or you're on even certain medications can preclude you from having implants.
So with a dental implant, is this something that's happened? Maybe a tooth has been extracted, maybe you've been missing a tooth for a while. When do you find yourself in need of an implant?
Well, you might be missing a tooth for a short period of time or a long period of time. One of the things that we do as well is we get a 3D x-ray to look and see what does the bone structure look like. So there has to be adequate bone to be able to place an implant. In some cases, you've been missing a tooth for many years, and without a tooth in that site for a long period of time, the bone has a tendency to kind of atrophy, dissolve, if you will, and it has to be rebuilt before we can even do the implant.
It seems like it is certainly highly individualized, that every circumstance you're really very carefully weighing to determine if this individual is a candidate and then what the benefits would be. Is it something for all ages?
For adults. It's not something for children. If you're still growing, the research has shown that growth or pending growth is definitely a contraindication, because you can put an implant into the jawbone. And keep in mind that implants are not teeth. Teeth will move as you grow. You have baby teeth that get lost. You have adult teeth. But if you put in an implant into, let's say, a child that's still growing, as a child grows, the implant will not move, and so it may be in the wrong position once they finish growing. So we wait for growth to be complete. Growth is usually assessed by the pediatrician. It might be assessed by an orthodontist, and once those people have determined that growth is complete, then we can do it in that person.
And we talked about an implant replacing a tooth maybe that had been missing for years, if there was a vacancy there. Is this something that's cosmetic, or is this functional?
It could be both. Usually it is functional, but there's a cosmetic benefit to it. And if the tooth has been missing for a while, many times what will happen is that the tooth behind that one, if there is one, might drift forward. The opposing tooth, whether it's upper or lower, might drift in the opposite direction. And so now we don't have a good space maintenance or space or adequate for the implant or even for the prosthetic that's going to go on top. In those cases, we'll send you to an orthodontist to see about getting the teeth lined up prior to placing the implant.
Interesting. So quality of life then, once it's restored, it's a little different.
It is. I mean, a lot of times people will come to us maybe missing a tooth for a while, but then they notice their bite is changing. The bite doesn't feel the same because the teeth have drifted. They start using other teeth more so than they would if the full complement of teeth were there. So that's all functional, not so much aesthetic. Like I said, there is an aesthetic benefit, certainly if you're missing a tooth in the front of your mouth. Some patients will come and say, I want this. There are other ways to replace missing teeth, but the implant is the one that does not come out. The implant is, put into the jawbone, and it's usually the part of the prosthetic or part of the replacement that you don't see. The prostheses is what you do see.
Interesting. The art of implant dentistry with Dr. Carl Block here at Virginia Family Dentistry. Thank you. I have a better idea of what implants are all about.
Thank you.